Welcome to the Eye Experts. I'm Dr. Eli Sluch, and today we're going to be talking about corneal ulcers. The cornea is the very front of the eye that needs to stay clear in order for you to be able to see. It is the part over which you wear contact lenses or glasses. Besides other diseases, the cornea can get scratched, such as a corneal abrasion, or it can get an infection. An infection is when usually bacteria or fungi get inside the cornea and start eating it and causing an infection. Now, why is an infection worse than an abrasion? The microorganism that causes the infection starts eating away the tissue. So number one, you're starting to lose tissue. Number two, the body tries to fight off the infection, in which case the white blood cells come and start attacking it. This causes a lot of inflammation, which then leads to scarring. So it takes you nice clear cornea and makes it cloudy.
These are corneal ulcers. Notice the white spot, that's where the infection is, and it's starting to attack the cornea. You can see it's swollen and inflamed and red. The vision in these eyes is not very good.
The most common causes to get an infection is trauma, because the skin of the eye usually protects it, and when you have trauma and the skin gets a scratch, the bacteria or fungi can get inside it. The second cause of infection is probably contact lens wear for a similar situation. The contact lens is a soft piece of tissue usually that sits on top of the eye. Something can get underneath the contact and then cause an infection. Another cause is if you sleep in your contacts. This way debris can build up on the contact lens and then get inside the cornea and start eating at your eye.
This contact is clearly bent and dirty. This is why it's important to really clean your contacts and throw out damaged contacts. I also really do recommend you take your contacts out at night because you never know what's going to be trapped underneath and then result in a raging infection.
If you do have a corneal ulcer, it is imperative to try to diagnose it to see what kind of microorganism is attacking you, because different microorganisms require different treatments. The most common causes of corneal ulcers are bacteria, fungi, atypical bacteria, viruses, and amoeba. If you have a corneal ulcer, we start treatment with antibiotics, and if culture results are available, we're then able to better tailor that treatment to the infection at hand. The majority of corneal ulcers are able to be treated with antibiotic eye drops. If the infection is uncontrolled or the scar is too big, you may actually require to have a corneal transplant. If you have a corneal ulcer or have severe problems from a corneal ulcer, please make an appointment with an eye provider.